Hi, I'm Dr. Kelly Starrett with the Ready State. One of the things that we see often is that we have athletes who are coming to the clinician-centered clinic, and we have a condition that would benefit from decongestion. So how do we remove swelling? How do we remove congestion? How do we get non-threatening, non-fatiguing input into the system? The question is, where and when am I going to do that? Am I going to do that during my session time, during the hour or even half hour that I potentially have with the athlete? And the way we've solved this over the years is that we have created a lending library of H-waves. And what's nice about this is that it allows me to have this patient go home and decongest in their time. This frees me up to really work on the things that I want to work on in the clinic. And it allows the athlete to really get ahead of their congestion or sort of swelling problem when it makes sense for them. Because oftentimes what we see is if we're applying sort of H-wave in the home or in the clinic, what potentially happens is that we're utilizing a lot of time, or we're going to get these little mini doses when we know we'd benefit from sort of much more consistent and more regular decongestion use with the H-wave. So what's nice about this is that having a lending library means that our athletes can come and go. They can quickly, if something pops in, they even can come in and grab the unit even if they're not sort of being treated or being seen. This gives our athletes and clients a reason to kind of come back and stay in touch. Hey, I want to jump in and grab this lending library unit for a few days because I want to get ahead of something, or my knee's a little swollen, or my shoulder's a little congested. I don't think I need skilled care, but I think I can get ahead of this. What this also allows us to do, of course, is shift that burden and loci of control back to the person. So they're decongesting, watching TV, in the meeting, at home, sort of even over the night. And oftentimes we feel like if we can get more regular decongestion work, a lot of the sort of desensitization that I'm working on and working towards in the clinic gets managed by the person at home. So I'm encouraging you, if you already are a user of the H-wave in your clinic, grab a couple H-waves, put your name on them, and then lend that out as sort of an add-on adjunct to being one of your patients and clients, because it is a fantastic way to build buy-in and also have that person have much better outcomes.